Hi, my name is Callie Summers, and today I'm going to teach you how to give an insulin injection for diabetes. Since I was little, I had always wondered how people with diabetes were able to give themselves injections anywhere they needed, quickly and safely, whether that be at their home or out in public at a restaurant. I always thought they needed to be professionally trained to do this to themselves, right? Actually, it's quite simple, and today I'm going to teach you how to do it yourself. Your first step in any health work is going to be cleanliness. This is for two main reasons. Your first reason is going to be for the patient. This prevents HAIs, or healthcare acquired infections. This is whenever a patient leaves the hospital with an infection that they did not come in with to begin with, due to our lack of cleanliness. The second reason is to prevent contamination in case any needle stick or accidental contamination were to occur between the patient and the healthcare worker. To do this, you must clean your hands for 30 seconds under hot, soapy water. Even if your hands are not visibly soiled, you must wash them before performing an insulin injection. After you've cleaned your hands, you're going to dry them and apply gloves. The third thing that you're going to do is clean the patient's skin for 15 seconds. So you will be given an alcohol prep pad just like this. You're going to tear it open. You will be given an alcohol square pad, and you're going to find out where you're going to inject. You're going to pick that spot and clean it. You're going to clean for 15 seconds in a circular motion, starting at the inside and working your way out, and then let it dry. If you're going to be using an insulin pen, you do not need to worry about this next step. However, if you are going to be using a syringe and a vial like us today, you're going to follow this next step. For the fourth step, you're going to clean the vial that you are drawing up your medication out of. That is simply just by taking the top of the vial where you would inject and taking a clean prep pad, cleaning it again for 15 seconds in a circular motion. Now we're going to draw up meds. You are going to be given either a 3 milliliter or a 10 milliliter syringe. Today we have a 10 milliliter. Now normally you would have a needle on this, but for demonstration purposes, we do not have one on there today. What you're going to do is you're going to find out how much insulin you need to draw today. So let's say we need to draw 5 milliliters of insulin. I need a 5 milliliter injection. I'm going to draw up 5 milliliters of air. The next thing I'm going to do is I'm going to flip over my syringe, and I am going to inject my needle into the vial. I'm then going to push all of the air into the vial. This creates a vacuum seal for whenever I flip it over. So once I have the air injected, it creates a vacuum seal and the medicine wants to come out into the syringe. We're then going to draw up another, 5 milliliters. We have our 5 milliliters in our syringe that we have drawn up using our vacuum seal. And now this is ready for injection. Here's how to inject our syringe now. You're going to clean the skin. So we're going to find our area that we want to clean. Usually the best spots for injections are kind of behind the arm for the fatty areas, the stomach, or the hips, thighs. Today we're going to be demonstrating on my hand. So we're going to clean our area, again, 15 seconds starting on the inside, working our way out. And once that is clean and dry, then we're going to take our syringe with our needle on it, hold it at a 90-degree angle, depending on wherever you're going to be giving your injection. We're going to be giving it on our hand today. We're going to inject at a 90-degree angle, put all of our insulin in, and let it sit in the skin for about 10 seconds. You want all of the insulin from the tip of the needle to actually go into the body. Once it's been sitting for 10 seconds, you want to pull it out. At this point, you do not want to wipe any blood or any liquid that may come out, as that may be insulin. And now you are all done. That is how you give an insulin injection with a syringe. In 3 steps, you were able to do that. The first thing is, remember, clean the area. The second step is going to be drawing your meds. And the third step is going to be administering the injection.